In the dim, controlled environments of Nazi concentration camps, certain names became closely associated with some of the most disturbing medical experiments in history. These were individuals who held medical degrees, who understood the value of human life in theory, yet chose to act in ways that contradicted everything their profession was meant to represent. One of the most widely known figures was Joseph Mengele. Stationed at Auschwitz, he became particularly associated with experiments on twins. When new prisoners arrived, he would often stand on the selection platform, identifying twins among the crowd. These individuals were separated from others and taken into his care, not for protection, but for experimentation. Mengele's interest in twins was driven by a desire to understand genetic similarities and differences. He conducted comparative studies, subjecting one twin to a procedure while observing the reactions in the other. In some cases, he injected chemicals into their eyes in attempts to change their color. These injections often caused severe pain, infections, and permanent damage. Blood transfusions between twins were also performed, sometimes with incompatible blood types, leading to serious complications or death. Another figure was Sigmund Rascher, who carried out high-altitude and freezing experiments at Dachau. Rascher used low-pressure chambers to simulate the conditions experienced by pilots at extreme altitudes. Prisoners were placed inside these chambers while air pressure was reduced. As oxygen levels dropped, victims experienced dizziness, convulsions, and eventually loss of consciousness. Many did not survive. Rascher carefully documented the physical reactions, often repeating the process multiple times. Rascher also conducted freezing experiments. Prisoners were immersed in ice water or left exposed to freezing air for extended periods. He recorded how long it took for body temperature to fall to critical levels and tested different methods of rewarming. Some methods included placing victims in hot water or exposing them to body heat from other prisoners. These procedures were not designed with care, and many subjects died either during exposure or during the rewarming attempts. Karl Klauberg focused on sterilization experiments. Working primarily at Auschwitz, he developed methods intended to rapidly sterilize large numbers of people. His approach involved injecting chemical substances into the reproductive organs of women without anesthesia. These injections caused severe pain, inflammation, and often permanent damage. Many victims suffered long-term complications, while others did not survive the procedures. Another physician, Herta Oberhäuser, participated in experiments involving wound treatment and infection. Prisoners, particularly women, were subjected to deliberate injuries. Cuts were made into their skin, and foreign substances such as dirt, glass, or bacteria were introduced into the wounds to simulate battlefield conditions. Various drugs were then tested to observe their effectiveness. The suffering caused by these experiments was prolonged and intense, and many victims were left with permanent disabilities.